All right, so welcome back to the first presentation block of the afternoon. We're going to get started with Emily Johnson, Lauren Beasley, and Dr. Stephen Waller from the University of Tennessee, and they're going to be presenting on chaplains and social workers, a theoretical understanding of holistic care partnerships in sport. So you guys can take it away.
Awesome. Well, thanks y'all for having us. If y'all remember back pre-COVID times, back in 2019, Dr. Waller and I had presented some of our initial work on the relationship that the interprofessional relationship between social workers and chaplains. And that has really spurred this project out of interprofessional competence and interprofessional education literature. There's a big push to when working together in a team, to knowing the theoretical foundations of other disciplines you're working with and the historic foundations of other disciplines you're working with. Because then you can if you know the theory behind their work, you can better figure out in which ways you can plug in to work together. So that was really what spurred this presentation.
Yes. So kind of the statement of the problem. It's not really a problem, but kind of the whole purpose of what we're talking about here, and we do have a paper under review as well, is particularly about the idea of interprofessional care teams and how within that there is this spiritual care of athletes that is an essential component of that care team. But at times, it is not particularly clear on who should be offering spiritual health advising. I mean, of course, a lot of programs have sport chaplains, but sometimes spiritual health bleeds into mental health as well. And so there's kind of this blurring of boundaries. And so that's where we kind of get this idea. It's not particularly clear sometimes who should be offering that spiritual health advising. And so just kind of reiterating, if any of you sat in on Dr. Waller's and Lauren's presentation in 2019, kind of reiterating this idea of interprofessional care teams. In other words, holistic care. You see it in a lot of different ways and different terminology in the literature, but we're particularly using interprofessional care teams and or holistic care throughout this presentation. And so in 2016, there was this model that came up, and now we want to include, of course, social work into this model. So you have, coach, attorney, sports psychology consultant. We have our chaplain, sport chaplain, and we want to include, of course, social work into this model. And it has been included in a lot of Lauren's work, since 2016. And so this has originated from kind of healthcare best practices. So a lot of times, if you go into a hospital, you're going to have your primary care physicians, you're going to have your behavioral health providers, you're going to have your psychiatric practitioners, you're going to have your occupational therapists, so on and so forth. And they're all going to come in, you're going to have your chaplain, and they're all going to come in and work with that patient in the healthcare setting. And so again, just reiterating that now we are adding we're both fleshing out the sport chaplain and we're adding in social work into this model. So the purpose of this presentation, more specifically, is we want to really examine the unique professional collaboration between social workers and sport chaplains. We're making the claim here that sport chaplains and social workers have a unique and really special opportunity to come together, perhaps in a different way than maybe some of the other other professionals within that holistic care interprofessional collaborative or care team. And part of that kind of examining that collaboration is really considering the theoretical considerations from both professions. So we have the sport chaplains, and I'll keep this slide really brief as we move through the presentation. We'll touch on these two things in more detail. But sport chaplains, holism is their primary theoretical foundation, and has a place in the history of chaplaincy and sport chaplaincy, and particularly in chaplaincy certification. And then social workers work from the ecological systems theory, and there is an element of incorporating spirituality in that section. system, whatever I'm trying to say. Little rough since it is summer. Okay, so moving on. So kind of trying to address everyone in the room. There's probably some folks in this room that are very well versed in the foundation of chaplaincy and some folks who are not. So really brief here, the term chaplain, as we use in this particular slide, represents both men and women, ordained and not ordained, of any faith, tradition, religion, or spiritual path. The word chaplain initially referred to representatives of the Christian faith, but it is applied to men and women of other religions and philosophical traditions as well. Chaplaincy is recognized as a ministry within hospitals, prisons, the military, and now sport. And the two primary the governing body of chaplaincy is the Association of Professional Chaplaincy, APC, and then there's the Board of Chaplaincy Certification, the BCCI, and this is where professional chaplaincy becomes standardized, and there's a ethical code of conduct, and this improves professional standards for chaplains. So now we transition to the foundation of sport chaplaincy. So sport chaplaincy has grown over the last 50 years. It started in the NFL, and then it quickly moved through other professions and mega sport arenas. The Fellowship of Christian Athletes is one of the significant providers of sport chaplains training programs, and they're located in Auburn. But there is this movement within sport chaplaincy that is calling for more standardized, all-encompassing certification. And largely, sport chaplaincy is a little bit more of a generic heading in that your job responsibilities as a sport chaplain is going to vary widely. And because of that, there's a few different reasons why there's this call for more certification within sport chaplaincy to really hone and define exactly what it is that a sport chaplain does in the day-to-day and their interaction in this space of the holistic care of student athletes and other individuals in sport. So we move to the foundation of sport chaplaincy, which is holism. I alluded to this earlier a couple minutes ago, but this is the common theory behind chaplaincy in general. And so it's this whole idea that the whole has primacy over each individual component within that whole. So it's the idea that you want to address the person as a whole. You can't just treat their physical health and expect the rest of the body to fall in line. Or you can't just treat their mental health and expect the rest of their body to fall in line. You have to look at the individual as a whole entity, and that's why it is so critical to have a holistic care interprofessional team come together and treat all those individual components so that the person can feel whole. And much of the strategic positioning of chaplains, again, within healthcare, within sport, is based in holism. So interprofessional care teams, holism, sport, this is very common in hospitals, as we've said a multitude of times already. And so again, there is a lot of work being done actively advocating for applying holistic care in the sport-related fields. How can we get all the different professionals working together, but not only working together, but understanding what the other professionals in that space do? Because I think there is a lot of folks out there, and we've talked to, and Lauren will talk about this toward the end of our presentation, but there's a lot of professionals out there who don't know what the other does. And I'm sure there's a lot of folks in this room who might not be fully aware of how a social worker might be able to be a good advocate in this, a good professional in the interprofessional care team. We've done this presentation at social work conferences and vice versa. What do sport chaplains do? And so really advocating for professionals coming together, working together, but also understanding each other, which is very critical to make that team work well. And so, this is where integrating, again, again, reiterating this idea that holistic care is kind of this new wave, of how we're going to treat individuals, and integrating a specialized professional, the sport chaplain, a social worker, is in the best interest of athletes and the holistic care team from a spiritual care perspective. So within the athletic context, of course, sport chaplain is used most commonly. And the interprofessional collaborative practice recognizes the importance of these key individuals here. Okay, so moving through some of the ethical practice considerations. One of the primary concerns about sport chaplains is how their professional identity is formed and positioned. So are they affiliated with the APC? The APC, as I mentioned earlier, is who provides professional certification and a code of ethics for chaplains, but there's not necessarily, there are not many chaplains who are APC certified, or certified through APC. So that potentially could, be a problem. As of right now, and I know that Dr. Waller's done a lot of work on this, and he can talk about this in the discussion as well, there's not really a universal governing body for sport chaplains in the US. I know that we're trying to get one up off the ground. And so that's also important. How can we provide a solid code of ethics? How can we get sport chaplains into APC? How can we create a more define this profession in a more ethical way, I guess, is what we're trying to say here. The Seeds Sports Network is striving for this. It's a nonprofit entity, and it's advocating for registration, education, and mentoring. It's not necessarily a gateway for professional chaplaincy, but it's a gateway for sport chaplains. Again, continuing to legitimize sport chaplaincy, so calling for the APC to create a sport chaplaincy section within the APC, that would be very helpful. It's important to, at this point, a lot of Dr. Waller's work has talked about this idea of credentialing needs to take precedence so that sport chaplains can have that credential behind their name. They can have the education behind their name, the training, the mentoring, the code of ethics, to be able to then go out into this particular interprofessional collaborative practice and work with all these different individuals within that team confidently. And then this idea to develop an entity that will provide governance and policy frameworks that will, again, provide this collaborative work of the sport chaplain. And something to consider here, particularly, I think a lot about, and I'll mention this later, I'm sure, too, about, COVID-19 and the impacts of that as well on individuals and all the things that are happening in our society and our culture. A lot of our athletes are going to have very deep wounds, and those deep wounds a lot of times might need a clinical intervention. And so part of ethical practice is knowing when and how and who to refer to when, perhaps for the sport chaplain, they're not trained necessarily to deal with depression or anxiety or any other, a whole host of other mental health issues. And so knowing I'm recognizing this experience for this individual, and I need to bring in a social worker into this situation to help with treating them. Again, understanding the limits of your training, always putting the needs of the athlete first, and knowing when, okay, this is the line, and now we're going to bring in somebody else. At times, finding out how can we meet those clinical needs, but then also spiritual guidance together. And again, this highlights the importance of this interprofessional care team. And it's vital, going both ways, for social workers to understand these ethical implications of sport chaplaincy, and for sport chaplaincy to understand where social workers are coming from. And that can really create this very unique, but also very viable participation and partnership between social workers and sport chaplains.
Awesome. Thanks, Emily. So now kind of moving into what social work is, right? One of those ethical considerations Emily was hitting on is that when it becomes a clinical issue, a professional with a clinical mental health license is most likely going to need to be brought into that partnership. And so social work is one professional that you could consider working with. What's really cool, social work, you might see two different licenses. So in the United States specifically, so there are clinical licenses, which you'll usually see like LCSW. And that means that individual has gone through the extra about 3,000 practice hours post a master's level graduation to do individual one-on-one clinical therapy. You could also work with a social worker who has an LMSW. So that's a social worker who is licensed at the master's level. And they usually do like supportive counseling, but really that professional can work on a case management basis. So if you're working with an athlete who has seen a lot of different professionals and it's hard to kind of bring all the professionals together, a case manager might be a really great option. Or if you're working with an individual who, maybe needs extra food assistance, right? Or help with their family's utility bills, even stuff like that is something that a licensed master's level social worker could really work with. So moving into then kind of that similar foundation to what is social work. So social work is governed by the National Association of Social Workers, this governing body in the United States. To call yourself a social worker, you must be licensed. That is legal in the law. And so under the NASW, the social workers have 6 core competencies and 6 core ethical considerations. First and foremost is service. So social workers' primary goal is to help people in need and address larger social problems. Social justice, that social workers are going to challenge social injustice in their work. And part of that macro level social work, you might hear that terminology, is really fighting social injustice through policy, through advocacy efforts. So if you're working with an individual athlete who like a certain policy is really troubling, or there needs to be a change in that organization, a social worker can be really great. Dignity and worth of the person. So social workers are going to respect who that person is. And part of that, as I'll get into, is assessing for spirituality. And keeping spirituality, if it's important to that individual client, within our care plans. And then, of course, importance of human relationships, right? Understanding that change happens through relationship. And then integrity and competence is really where we're going to focus on, I think, towards the end of this presentation, that social workers must practice with integrity. And to do that, they must only practice within their competence, meaning if and that goes with specific populations. So a social worker, if they're working with athletics, should at least have some continuing education, right, credits, thinking about athletic culture, or at the very least, right, if they're working in college athletics, should have some practice experience or should have some continuing education work with the college population, even generally. So knowing that it is okay, if you're wanting to work with a social worker, to ask about their experience with athletes or with that age group or with a certain clinical diagnosis. Sorry. So thinking historically, right, where is social work coming from in the United States specifically? It certainly has kind of different historical roots in other countries. But as I touched on, social workers are trained in clinical work, case management work, and that macro level advocacy work. And we can see that historically from 2 primary movements. First, some of the more macro level work really grew out of Jane Addams' Whole House. You might have heard that. There's certainly been some critical conversations about the history of that that's really important to discuss. But kind of just generally for the purposes of this presentation, the Whole House was in Chicago, and they really worked on not only, they actually used sport quite a lot as an intervention to work with youth, but they also worked a lot on policy, kind of bigger level policy, and advocating for neighborhood changes within the neighborhood and policy changes. So that's where kind of that macro level social work comes from. The charity organization societies is more that micro level that turned into clinical work, case management work. And that's where back in like the 1800s, 1900s, coming out of really New York, social workers would actually bring together a lot of organizations that were offering aid. So this is where that partnership between social work and really religious organizations stemmed, is that social workers would work with clients to connect them, right, to these different organizations that could help them. If it was food, you could go here. You know, if it was clothing, you could go here, those utility assistance here, whatever it might be. And so when those first started, it would be literally like one on a Saturday morning, right? All the organizations would come into one place, clients would come in, and the social worker would kind of direct the clients, right, to, okay, go visit this organization or go talk to this person. So that's where that case management role really came from. Thinking about social work in sport, it's really growing, which is really awesome. We're seeing it used to be more dominated by psychology, and psychologists were more often hired in sport organizations, but we're seeing the increase of social workers not only being hired in kind of that clinical role, but also being hired in the case management role. And so thinking about a case manager that's on staff in an athletic department, wanting them to know, right, that sport chaplains can be a resource and can be a referral that they can make for a student athlete. Awesome. And so just like we did with sport chaplaincy, right, we went over the historic roots of social work. We're now going to go over the theoretical roots of social work. So social work practice is pulled from Bronfenbretter's ecological systems theory. And Bronfenbretter was actually a child psychologist. And in his work, he was kind of working one-on-one with kiddos who maybe have aggressive behaviors, had anxiety, depression, those kind of diagnoses. And he realized that kind of that individual one-on-one intervention wasn't working. And so he conceptualized his interventions through these many different systems. So it's not only working with the client at the micro level, one-on-one clinical therapy, but also understanding that that person's well-being is impacted by the interactions of people around them, meso level. It is impacted by the organizations they're embedded in, the exo level. It's impacted by the culture they live in, that macro level, and also impacted by the time, right, that they are living in. So for example, we might think of COVID as a chrono level, right, experience, this unique time that we are living in. So this is going to be the base of a social work, a current base of a social work assessment. And what's really key in that then is when we're assessing a client, right, we're not only looking at, okay, they're presenting with depression, which is usually the approach of more micro level focused professions, such as psychology, counseling, which can be a really effective approach. But specifically with the partnership and really the claim we're making with chaplaincy is that part of our assessment too with any client is meso level, right? Who are they interacting with daily? And that exo level, what organizations do they work with? So in many, many cases, right, it's going to be assessing for what religious community are they in? Is spirituality a protective factor for this individual? And if so, if they are embedded in a religious community, how can we use that community as part of our care plan, as part of that intervention? So social work really uniquely looks at those factors and therefore works with religious organizations a ton, works with chaplains a ton. When I was in the more hospital side, hospice side of social worker, as I'm sure many of y'all know, right? Like that relationship with that chaplain was so important to connect those individuals to their spiritual needs. And so understanding and looking at the similarities between holism and this kind of ecological systems approach, it seems that these two professionals within the sport context can work really well together. But also thinking about, just as we talked about some ethical considerations with chaplains, right? Ethical practice considerations for social work in sports. This is, I think, is a really powerful quote when we're talking about, if you remember back to some of those standards that social workers are held to through their license, competence is a huge one. So if we're not trained to work with a population or we're not trained to address a specific issue, then we shouldn't be doing it. And ethically, right, then we have to make that referral and work with another professional who is specialized in that. And that's really what this quote gets at, right? Carrington states, although I am a social worker, right, my approach may be guided by a spiritual paradigm. So if an individual uses spirituality as a protective factor, sure, we can kind of bring in some, scripture that might be really helpful in that session, right? And I may utilize spiritual theories and procedures or even discuss religious concepts with people totally within our competencies. However, it is not within my role to give spiritual instruction. For that, there's a need for appropriate referral to a suitable spiritual practitioner, right? So knowing that social workers have that boundary of practice, that if this is a spiritual issue, right, we need to bring somebody in. We should be working with somebody such as a chaplain, right, who can work on those issues. And social workers know that, right? Like we are bound to these legal competencies by our license legally. And so if we work outside of our competence, that's enough for us to lose our license, and we can be brought in front of the board for that. And so when we gave this presentation to a group of social workers, right, they were all on board, and there was a lot of them didn't even know that sport chaplains are really a thing, or that could have been an appropriate referral to have. And the question they kept bringing up to us is like, how do I find these people, right? Like, I want to be that competent social worker. I want to make that ethical referral. Where do I find them? And so that would be looking back, the benefit of continuing to professionalize sport chaplaincy as a field can be to have that overarching governing body where a social worker could reach out to that, organization, say, hey, I need a certified chaplain in this area who works with athletes, right? So it can make that referral process a lot smoother. So with that all in mind, we wanted to end with some specific practical practice recommendations for this partnership between a sport chaplain and a social worker working with athletes. So first and foremost, we know from literature that athletes have low help-seeking patterns due to mistrust of outsiders. And because of that, the referral between a social worker to a sport chaplain, or from a sport chaplain to a social worker, may be really, really important. We also know from research that if an athlete is referred to a social worker or to a mental health professional from somebody they trust, that referral ends up going, not surprisingly, much better, right? Much smoother. The athlete is more likely to continue seeing the mental health professional. And because chaplains are working so closely with the teams, usually more so even, right, than the mental health staff, if you're traveling with the team, which social workers aren't allowed to do under the license, we can't practice across state lines. The athletes trust y'all. And so having that trust and then being able to refer them to an appropriate mental health professional could make the referral process go smoother. From the social work side, right, if the athlete we're working with endorses spirituality or religiosity as a protective factor in that initial micro to macro level assessment, right, we know that this faith-based interventions is going to be useful in our care plan. So we're going to want to incorporate a sport chaplain. So if you're able, right, to think about what are social workers or other mental health professionals in my area that are working with athletes, and reaching out and creating that initial relationship could lead to referrals from that social worker in the future. And then finally, as we've kind of touched on throughout the program so far, we really should be implementing a model of interprofessional care as we see in hospitals, as we see in hospice, where all those professionals can get together and meet, right? Even if it's just once a month to discuss their cases, that could be a really wonderful way to gain professional insight from all professionals who are at the table. And then finally, because we're kind of really asking for sport chaplains to be a primary referral source, right? Another benefit of having some type of more specific training recommendations or code of ethics for these sport chaplains would really allow for a formalized way for sport chaplains to get cursory level clinical training so that they can recognize when, they're working with a client on spiritual guidance, okay, this is a red flag for clinical depression. This is a red flag for clinical anxiety. I'm trained in that, so I know who I can then go make that referral to.
So Thank you, Lauren. Yeah, just a couple concluding thoughts here. For the sake of time, feel free to read through these, but I think the main point here is, there's this willingness to do what is best for the person in sport. Again, really truly understanding and respecting the professional boundaries is going to do so much more for that person in sport. And some of the best ways to do that is to know and respect the other profession by understanding the history and the foundation of that particular profession, which is a big purpose behind presentations such as this that we've given here and to social workers. Again, don't be afraid to incorporate and or refer the social worker into your care of the athlete. That unique and really special partnership, as I talked about, as Lauren talked about, is a great resource for everybody involved and is going to really help ultimately help the athlete perform the best that they can, but then also be the most in life in general. So anyway, thank you for listening. Now I suppose we open the floor for discussion and questions.
Nicely done, ladies. I have a question.
Yeah.
You were talking about the ethical similarities and differences. I was kind of thinking that through from a practical standpoint. So if I were I'm a sports chaplain, and maybe Stephen can jump in and just kind of tell me if I'm up the wrong track. Title IX reporting differences. I would assume that a social worker would kind of be an automatic reporter, but that a chaplain might or might not be an automatic reporter, depending on how the university had set it up. They might be the confidential one. Is that correct? What do you guys think of that?
Yeah, I can speak. Social workers definitely are mandatory reporters.
Sure.
Absolutely. I'm not sure. I know that Title IX laws, as I'm sure we're all familiar with, has somewhat changed specifically in college athletics, right? How they've taken away so now coaches aren't necessarily mandatory reporters. I don't know, Dr. Wall, if you might know more about that from the chaplain side.
Yeah. If in fact a chaplain is working with high school students or college students, they are given the status of a mandatory reporter. So if there is an offense of any type that represents a violation of a minor or of a young adult, then you're compelled.
Yeah.
Now, the unfortunate part about it is that hasn't always happened. And
Sure.
subsequently, where that goes is into a court of law.
Mm-hmm.
And that's one of the big arguments, that we make with sports chaplains. You have to consider the legal dimensions of what you do, particularly when it comes down to, again, your compelled status, like being a mandatory reporter. You just can't turn your head and walk away and say that, well, that happened on somebody else's turf and not do anything about it. I think in the last 5 to 7 years, we've probably seen 4 to 5 cases that have ended up in a court of law that have involved chaplains and coaches because either students or players have given notice of an offense and everybody just kind of sat on it.
I'm not even positive, Stephen, but I'm guessing that at Baylor, I bet our sports chaplains are mandatory reporters, but our university chaplain is still considered an anonymous path for our students.
Yeah.
It's kind of interesting. I don't want to get into the weeds, but I couldn't help but think about the difference.
No, we can totally get into the weeds. I know what's interesting with social work. I mean, clearly, like I said, licensed, we are mandatory reporters. But I don't know if y'all remember TerraSoft. The TerraSoft case was out in Berkeley, I think. And so part of our license, though, it's really confidentiality is one of our primary ethical standards. And so it really is looking at, is this person in imminent harm, right? Is somebody at imminent harm, right? And if so, yes, we have to report. With some previous, like if an assault or abuse happened 10 years ago, if that client isn't in immediate harm, a lot of actually within our license, we're supposed to first work with that client to think about coming forward themselves, right? Like that empowerment is more important in that kind of moment. So it is, I mean, we could get down, like social work has gone through those weeds too of really what mandatory reporting means, right? When is the client actually in harm, and when would it do more harm to them to force, you know, a outcry at a certain point when they're not ready. So.
All right, I think David had a question.
Sure. Are we unmuted?
Yeah.
You can hear.
Oh, yeah. Okay, cool. First of all, great job, both of you. You're both very engaging, and it's not just the background that you selected for your. I haven't really sat in a whole lot of chaplaincy presentations, and I've never actually heard anything about social workers within sport.
Yeah.
Very new. I've seen it firsthand in care plans within like VA hospital, but I've never seen it within sport. So I think that's really cool. Do you think I guess it's more for Lauren, but
yeah,
you see a role more for social workers within athletics specifically, like having a role within, like you're hired by an athletics program. I know you talked about the because of licensure not being able to cross state lines. You know, we're talking about this whole virtual world. Is it against the law then, and your licensure, if they go on the road and you're still back in the state and you get on Zoom, once they cross state lines, is that an issue? So that's kind of part of my question. The other part of it is are we going to see social workers, you know, working in universities in the future?
Yeah. So starting with the licensing question, yes. However, with you know, COVID has kind of stirred up a lot of things, not surprisingly, about virtual therapy. And so you've heard like even like Talkspace might be familiar to some of y'all, right? Kind of that virtual, I can pick up my phone and like text my therapist. Even in those kind of systems, you are supposed to, that service is supposed to match you with a therapist in the specific state that you're in. Of course, like it can be harder though to, oh, you know, since I'm talking to my therapist on my phone and I took a trip, you know, to South Carolina for the weekend or whatever, it's harder to regulate that. But because licenses do differ between state, every state has a different licensing requirements for social work. You are not supposed to practice across state lines. So like traveling with teams, like probably won't ever really be a thing unless there's some major overhauls to licensing because of COVID. If that answers that part of your question. There's a lot of social workers I know who you can become like dual licensed, right? So I could hold a license in Tennessee and hold a license in California. And if I'm licensed in California, living in Tennessee, then I can do virtual therapy with people in California because I am licensed there. So there are professionals who will get licensed in dual states. But like I said, COVID has really opened up that conversation. So we might see in the future some differences in some of those licensing requirements about cross-state therapy, which I mean, I think some type of federal license might be really helpful in the future so social workers can work cross-state lines. And I think those conversations are happening because of COVID. That's kind of, if that helps with that. The other part of the question, yes. So the majority of social workers right now that I know of that are working in college athletics are embedded in the athletic department. So they're hired by athletics. There's two different models, and I kind of touched on this, that are currently happening in college athletics. The first one is that individual holds their clinical license. So they're doing one-on-one clinical therapy with the athletes. Another model that's coming up, which I tend to like a little bit better, is they have a LMSW hired who does case management. So whenever the athletic trainer or the coach thinks something might be off, or a sport chaplain thinks something might be off that's more clinical, that athlete is referred to the case manager social worker who does a full assessment. And then from that assessments, we'll connect that athlete to different practitioners or different services in the community. And the university actually will that social worker works first through the insurance process, and then the athletic department actually covers the remaining cost of that individual therapy, if that's what that service is. And I think that model is really cool because then, you know, if the client is coming in and saying, you know, I'm just nervous about, this is an example actually from one of the studies I did. The client came in The athlete was an international athlete, had moved to a state that was really, the weather was very cold, right? And they were coming from a country with a very different climate, and was having a hard time finding winter clothes, right? Like something as basic as that. And that social worker then worked with that athlete to connect them to like a clothing bank in the community where they were able to get discounted winter coats. So I do like having that case manager on staff for those kind of issues and those kind of cases. The case management model, though, is less common. It's much more common to have this a clinical social worker on staff doing one-on-one therapy.
All right, thank you guys so much for presenting. We appreciate it.
Thank you all for listening.
Thank you.
Great job, you guys.
Thank you, Dr. Waller.
In this room at about 4:20, so take a couple minutes break and then we'll be back.